Okay, so let's look at the next scenario up there for us. So the next scenario we'll be looking at is folliculitis. Let's share the screen. Here we go. So we're going to be looking at folliculitis. In this particular case, you're an FY2 in a GP surgery. An 18-year-old woman has presented with the concerns. Talk to the patient and address their concerns. So the background information and opening sentence, doctor, I've got an embarrassing problem. When you ask what embarrassing problem you have, I've got a rash in the groin. Remember how to respond to doctor, I've got an embarrassing problem. Okay, you see, you don't have to be embarrassed. So we are professionals. Okay, we do see patients with all different problems, and we are used to seeing these things. We are used to seeing patients with different problems. Okay, so you don't have to feel embarrassed at all. Can you tell me how can I help you? Doctor, I've got a rash in my groin. Okay, and at the end, you have some questions. Is it contagious? Can I pass it to others? What caused it? Okay. So, approach to the task. I've got a rash in the groin. As usual, you take the history of the rash. Where is the rash? Where exactly is the rash? How many rashes? How did the rash start? Suddenly or gradually? Is it a rash or some spots? Is there any swellings? What's the color of the rash? Is there any bleeding? Any pus, any pain, any itching? Okay. Has the rash spread anywhere else? Has it ever happened before? Let's think of differential diagnosis, rashes in the groin. Allergic reaction, contact dermatitis, maybe underwears, okay, post-waxing irritation or shaving, STI, okay, lymph nodes, maybe from STI, herpes infection, ulcers, yeah? So we need to think, what could it be? Yeah, lymphadenopathy, maybe. So ask about, have you been using, for these rashes, have you been using new soaps recently? New lotions, new clothes, new underwear, anything different you have done unusual? Ash, have you thought of anything that could be the cause? Did you do anything unusual recently before the rash started? Just remind me, when did the rash start? Okay, and did you do anything differently, maybe in a few days before that or a week before that? Okay, so patient may tell you, okay, doctor, I had only waxing. Okay, so waxing, that's for hair removal. Yes. So which areas did you do the waxing? In the groin. Was it just a groin? Where else to do the waxing? You have to get exactly the location. And is it the same place where there are these rashes where you did waxing? Okay, good. So if you ask about waxing, so again, you're going to be asking more about waxing. What type of waxing? This particular patient had a Brazilian waxing. Now, generally, Brazilian waxing means removing all the hairs from the pubic hair, from the groin, around the anal area, everywhere in the perianal area, okay, in the genital areas. So it's more extensive hair removal. Ask about other history. Are you sexually active? Are you in a stable relationship? Do you practice sex? Any STI symptoms? Any discharge? Other than the rashes, any sweating, any ulcers? Are you running any temperature? Okay, how has this affected you generally? Can't walk properly, okay? So the rash is itchy, feel like it's scratching all the time. Yeah. Now, if you ask about it, waxing, is it the first time you've done waxing? No. Usually do the waxing. Do you normally do the same type of waxing every time, or this time you've done slightly different? Usually does a different type of waxing, but this time has done the Brazilian waxing. Examinations. Let me have a look, and you see that's the rash you can see. So as far as examination are concerned, we're going to check observations to check for temperature. Okay, look on the rashes, check lymphadenopathy for this patient. Genital inspection, of course. So this is a rash, what you can see in here, some redness spots that following waxing. Explain the diagnosis. He may have what you call superficial folliculitis, mild inflammation, okay, of the what? Hair follicles. That can happen following shaving or waxing, yeah? Generally, advised to avoid scratching. The more you scratch it, the more you make it worse, more redness, more swelling. Usually it heals without any scarring on their own. Okay, so what can you do? Apply warm, okay, or warm, wet compressors, yeah, compressions, yeah, warm, wet compressions. Avoid tight underwears. Wear cotton underwear. Apply salicylic acid on the waxed areas. Usually when you have the wax, you apply salicylic acid on the wax areas that may prevent this developing in the future. Offer leaflet about folliculitis. It's an inflammation of the hair follicles. Yeah, good. Explain that they can apply topical antiseptic to prevent or treat any bacterial infection that may be there. Yeah, topical antiseptic. Yeah. What also can help is to stop waxing for some time. So maybe avoid waxing for the next 3 months and then you can start again. There are some things that you can do following waxing that can prevent this. Yeah, using of what? If you do waxing to prevent it in the future, apply salicylic acid. Okay, good. So they're the things that can help as well.